My name's Sarah Pascoe and I came into hospital in April 2016 for sepsis. Initially I came into hospital because I developed a fever really quickly, and we called an out of hours doctor who saw me, prescribed me some antibiotics and some paracetamol, and then within half an hour of him leaving I deteriorated really quickly and started vomiting and shaking. My husband contacted 999 and an ambulance was called for me, but obviously at that point I was presenting as a usually well 40-something woman who had a temperature and a pain in her arm. They originally thought that maybe I had got a thorn in my elbow, but there was no puncture or cut or graze on my arm that was really visible. But by the point of coming into hospital, there was quite a lot of swelling. So they didn't understand or know, and we still don't know to this day, how the infection entered my body. But all we do know is it was so minute that people's perception is that you'd have a large open wound that had got pussy and was infected and really obvious. This wasn't obvious even when I came into hospital, how the infection had entered. So my understanding is that I came in via A&E, and I had some surgery on my arm to try and find where the infection was or what was causing the infection. And then my understanding is that after I sort of picked up and started improving, that I got very poorly really quickly and was moved to critical care and was put on life support. One instance, or a further instance of surgery on my arm, that my dad and my husband were called into a side room and they had to consent to my arm being removed if that was necessary, which as the wife or as the daughter or as the parent to my children, I feel huge guilt that you put your loved ones through that emotional process. So obviously they consented because all they want is to make sure that they have you at the end of the whole situation. 2 days after that I was then getting really poorly, and they were then again pulled into a side room and told to prepare themselves for me dying. The amount of guilt and annoyance that it was out of my control, I couldn't do anything about it, but the fact that I put them through it is horrendous. Because you always want to try and do the best thing for your family, and I was putting them through something I had no control over. A couple of days after the last operation on my arm, a couple of days after I came off of life support, the consultants deemed that it was probably the best thing for me was to go home, because for my mental health rather than my physical health at that stage. So I went home, but little did we know how poorly I was when I then got home. A couple of weeks after I came out of life support and got home, they then found out that I had cardiomyopathy, myocarditis. I'd suffered an attack on the heart rather than a traditional heart attack. And I had a period waiting for MRIs, echocardiograms and blood results to find out exactly how poorly my heart was. And all this while I was thinking the worst problem was that I couldn't move my left arm and that I might never be able to use my left arm. And then suddenly I'm told, like, you know what, you might actually die. And that was probably the scariest time, being consciously aware that I may die and being completely helpless to the fact that I couldn't do anything about it, that it was literally any second. And we spent a period of that 2 weeks of, if my husband went to work, that I would text him in the morning to tell him that I was alive. And it sounds so silly now, but it was like last thing at night, I'd say that I was alive, because my husband worked away during the week and he'd already spent a lot of time away from me, a lot of time with me, because I'd been so poorly, and obviously we needed to ensure that he didn't lose his job. And so when he was away, yeah, we had this thing of, are you alive? Are you awake? Because my biggest fear was not only, I came to terms with the fact that if I died, I died, I wouldn't know anything about it, but I didn't want my kids to find me. And that's the hard one. And so going through that period of really worrying about the children and trying to teach a 5-year-old how to dial for an ambulance and what to do if she found mummy asleep, and how to get out of the house, and all those things that go completely against parenting, because you've spent all this time going, don't play with the keys, don't play with the locks, don't touch the phone, don't ever go down the street on your own. I'm then saying to her, if you found me asleep and you couldn't wake me up, this is what you need to do. And again, huge amounts of guilt that I had to put that on my daughter. But my fear was that if I was there and I was dead, then what would they do, and who would come and get them, or how long would it be? That whole scenario goes through your head. But very luckily for me, I had private health insurance through my husband's job, and got to see a very good cardiologist who I have to take my hat off to, because he's done a good job. And I had a very good GP again, who he's kept me alive, and managed to get the echoes all through. And yes, I'm still on medication for my heart, and I've got to get through another winter yet without getting poorly, because I've had another dip again of getting sick. But I'm progressing, and I'm getting better, and my arm now does work, and I've just got a really nice big scar, which I tell the kids that I got attacked by a shark, because that's the best one to tell them rather than anything really scary. And some kids would get really freaked out by it. And I had kidney and liver failure, but you know what, they're minor. I decided that I really needed to go and get some new glasses, because I really wanted to be able to read, because I was having real problems reading. And so off I trundled to the opticians, and then the optician's sitting there saying, have you been poorly at all? Are you on medication? So I'm tick, tick, tick boxing. And then he, you know, in very serious faces, you need to see your GP. We think you've got some pressure on your optic nerve that's causing some problems. So I spoke to my GP, urgent referral, had an MRI on the Saturday, and then I had a phone call on the Monday from my GP to tell me that no, I'd actually had 2 strokes. And so I had they don't know whether I had the stroke while I was on life support or whether coming off. From speaking to the neurologist, it's so common for people to have strokes that have been on life support that's why it's just not checked, because it's so common. So I'd had quite a severe stroke on my left hand side, which has affected my language. Not that you'd know it, because I usually make up for it with lots of words. But I struggle with how I explain it is my day-to-day diction is there, but if you ask me to talk about anything too in depth, I can't, and I use the wrong words. But also reading, I've lost my reading ability. I only ever see the first 3 letters of a word, So it's a little bit like when you teach a child phonics, but I only see the first 3 letters, so I can't even put all the sounds together because I just don't see them, because I've lost peripheral vision on my right side. And then I also had a stroke on my front right, which is my emotions. So I'm the only real noticeable difference with my emotions is I can lose my temper quite quickly, my tolerance levels, but my tolerance levels of noise or vision, so if I have quite a lot of visual stimulation, I can't deal with any noise, and vice versa. So when the kids are kicking off in the back seat and I'm driving, it's really hard work to zone them out, and I've really badly lost the ability to multitask, which as a woman we all know that's really important. But I've lost that ability, which is that's a sad loss. I would urge people, healthcare professionals, to go overboard, go and check for it all, because when I don't put blame on anybody's doorstep at all, but for example, the out of hours GP that came to see me, he didn't take my pulse, he didn't check my breathing. He went, yep, you've got a temperature, you've got some kind of infection, take yourself out of the duvet that you're wrapped up in, take some paracetamol and take some generic antibiotics. Maybe, just maybe, if he had gone through the checklist, he would have said, hang on a minute, this woman isn't right and there's something more going on here. And then that would have led to when the paramedic turned up. I had a car paramedic turn up first, and that person, as far as I'm aware, looked after me as best they could, but they were trying to get me an ambulance to obviously bring me into Trelisk. And again, they didn't know, or they didn't understand at that point whether I could have sepsis or not. They hadn't done the checklist either. And so I was then waiting 4 hours to get a ambulance into Trelisk. And again, that's nobody's fault. I was a 40-something presenting with sickness, pain, nobody knew. But again, maybe if that checklist had been put in place, they could have said, hang on a minute here, we've got a woman that we believe has got sepsis, we need to get her in. And I would have taken priority over some other people. People hear the word sepsis now, and that's amazing, because certainly when I got sick, I'd never heard of it. So people hear the word sepsis now, they understand that it can be serious. But I think sometimes people think, well, either you die from sepsis or you don't. And I think understanding what it can do to you, how aggressive it can be, how destructive it can be, visibly or invisibly, that's the thing that people don't necessarily know. And for me personally, it's the wider effect of sepsis. So it's the effect of when I was on life support, that my dad and my husband had to consent to my arm being removed. They had to be put through the she might die. That will stay with them for the rest of their lives. That has affected them. They won't talk to me about it because they don't want to upset me, but that's going to stay with them for the rest of their lives, because I know how that would have affected me if it had been around the other way. The effect that it's had on my children, Trelisk is known as Mummy's Hospital. My 6-year-old having nightmares about me dying and waking up not wanting me to die because she's had such vivid dreams of me dying. She doesn't want it to happen because she knows what it feels like. No mother wants their child to feel that. It isn't just about the sepsis, it's about the knock-on effect. Somebody asked me the other day, are you back to normal? And I said, well, no, but I'm never going to be normal. I live differently, I have a different life, and probably the only way of describing how it's affected me is, for me, it's almost like I've gone to live in a different country with a different set of rules and a different way of life, because I have to live differently now. I worry and I'm acutely aware of my health on the children. I have to make sure that they know how to get out if there's an emergency and what to do if there's an emergency. My husband constantly worries, if I get a cold, what's the effect going to be on my heart? So we live very differently. And at no point is it going to be, yeah, I'm okay, I'm about 95%, because it will never be like that. So you don't want to moan, because you know how grateful you are that you have survived and you are alive. And like I said, when I got out of hospital, I thought the worst thing was that I might not ever use my arm again. And that's how I felt for, a good couple of weeks. And then it was, hang on a minute, you might die. And that's a huge wake-up call.